At what age is scoliosis diagnosed? Scoliosis affects all ages, but it's most commonly diagnosed in children. And while it's considered to be a childhood condition, adult scoliosis is also something that is diagnosed once skeletal maturity has been reached. And the actual rate of scoliosis actually increases with age. So as we look at every generation or every decade of patients, meaning 20 to 30-year-olds, there's more patients who have scoliosis at that age than at adolescence. And when we look at 30 to 40-year-olds, it's a bigger population of patients at that age versus the 20 to 30-year-olds and so forth. And when we look at patients in the groups that are 60 to 70 years of age, this is actually the largest group of patients percentage-wise in terms of having scoliosis. So we know that it's mostly associated with children, but however, the most prevalent population of patients with scoliosis is actually adults. And as patients get older, the prevalence increases. So scoliosis is diagnosed typically through a combination of physical examination and x-rays to confirm the diagnosis. Scoliosis involves the development of an unnatural sideways bending, rotating curvature that occurs normally in the thoracic or lumbar spine. Typically, an x-ray is required to confirm the rotational and Cobb angle size, and a Cobb angle is the standard of measurement of a scoliosis that is taking the most tilted vertebra on the top of the curve, comparing it to the most tilted vertebra on the bottom of the curve, and measuring the angle in degrees. And there needs to be a minimal measurement of 10 degrees with rotation for it to be considered scoliosis. The most prevalent diagnosis is something we call adolescent idiopathic scoliosis, and this is typically diagnosed between 10 and 18 years of age. This group is at most risk for rapid progression because growth that triggers progression, and puberty is characteristic by rapid, unpredictable growth spurts. So we unfortunately see that this is the most commonly diagnosed age, but it's not the largest group with scoliosis. There is other types of groups that can have scoliosis, and we look at things like congenital scoliosis. Congenital scoliosis can be diagnosed at birth, and this is when babies are born with a condition in their spine called a hemivertebra, or a malformed bone. And this hemivertebra occurs in utero, meaning one of the bones didn't fully develop like with the others, and this can lead to a curvature. And typically this will be diagnosed as an infantile scoliosis that's diagnosed somewhere between younger than 3 years of age. Juvenile scoliosis is typically diagnosed between 3 and 10 years of age, and patients that have adolescent scoliosis typically have a juvenile scoliosis that the curve was small enough they didn't find it. So it's only when it's diagnosed is when they classify the age. And adult scoliosis is diagnosed once patients have reached skeletal maturity. The most common type of adult scoliosis is adolescent cases that weren't diagnosed, and they find a diagnosis in the adult form. This is like 70-80% of them. However, there are adult onset cases that typically occur as a result of abnormal degeneration to the spine, or some kind of trauma or some kind of disease that affects the spine in a negative way that leads to the development of a rapid progressing scoliosis. Now, we do know that early diagnosis can help treatment. Scoliosis is always a progressive condition. It is nature to worsen over time. And as it worsens, we know the treatment becomes more difficult because as the curve gets bigger, the treatment becomes more complex. There's never any guarantee when it comes to treatment, but early detection that's met with early intervention typically is associated with greater treatment success. So early treatment when you find it, is definitely recommended. However, most scoliosis patients are not treated in this manner. Normally they're recommended to do nothing, and the curve continues to worsen. And as it worsens, it becomes more complex and becomes more of a problem to deal with. This is particularly true when treating children with scoliosis, because as they grow and as the curve worsens, and this can happen very rapidly, that the curve becomes very, very aggressive as the curve gets bigger, because as the curve gets bigger, it's also more likely to get bigger. So these two things tend to feed each other, and it can become a much more complex condition to treat. In adult phases, most adults are responding to the pain. They're feeling some type of symptom and they're experiencing pain, and they go in and get an x-ray taken and they found out they have scoliosis. And this is also true that in adult patients, curves also worsen, but they worsen slowly in midlife. I like to say between 20 and 50 years of age. Then they start to take a more of a rapid phase of progression. They start to increase faster somewhere post 50. Then every 5 to 10 years, they increase the rate of progression. The most common age patient I treat in adolescence is about 12 to 14. The most common age patient I treat in adult stages is between 50 and 60 years of age. Now, both those groups had scoliosis prior to those times. They just weren't having enough symptoms or seeing enough problems for themselves to warrant treatment. In both those cases, treating it early would always mean a better result. Now, progression always means the curve is getting bigger. And as the curve gets bigger, so does the effects on the body. It causes increased uneven forces. It causes increased postural deformity. It causes increased rigidity, more likely to feel pain, more likely to have discomfort, and it can make the spine less responsive to treatment. I always say we can only reduce curves a percentage of the curvature. We can never cure scoliosis. There's no cure, not even surgery cures scoliosis. We're always reducing a percentage. So as curves get bigger, the percentage we can reduce will always be bigger than if we treated it earlier. Because if we treat the curve earlier, we prevent all the progression and reduce from that percentage. So I always say, like, if we reduce 30% of a curve, reducing 30% from 20 is way better than reducing 30% from 50. So treating a curve smaller is always better. And we also know that all severe curves, like I mentioned, were once mild. So treating it in its mild form is more likely to prevent a severe case from happening. So here at Scoliosis Reduction Center, we have treated scoliosis in almost every age group, from adolescence to infantile to juvenile to adult cases to older adult and even late stage life. The oldest patient that we've treated has been in their 90s, and we've treated their scoliosis to reduce it and preserve the integrity of their spine so they can live a healthy, long life. I know we're looking at patients that in this older age group, we'd say, well, why even is it worth treating it? Well, if this patient had longevity, which they did, their family lived into the hundreds, you would say, well, it makes sense to treat it. So we know it's progressive, and we know the severity is based upon how big the curve becomes. And we also know as the curve becomes more severe, it's more likely to become severe. So the best time to treat any type of progressive condition is always as soon as you find it. So we always recommend early treatment over reactive treatment. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.